My name is Michael Temple. I'm one of the third-year internal medicine residents here at the Medical College of Georgia and one of the second-year ultrasound fellows. Today I want to talk about detection of fatty liver on point-of-care ultrasound. So objectives today are to talk about in our IVC assessment and cardiac POCUS, specifically the subxiphoid, we get these incidental views of the liver, talk about liver basics and a brief overview of fatty liver progression, and talk about assessment of liver on ultrasound to detect fatty liver disease or cirrhosis. So here we're doing an ultrasound of the IVC as well as transitioning to the subxiphoid, and in both of these views you incidentally see the liver come into view. You can also scan across the liver to get a better view of the liver itself. Here are the stills of the subxiphoid and IVC, and you can see in both of these that you incidentally bring the liver into view. If you see anything on the liver that's suspicious, you can do a more thorough evaluation of the right upper quadrant, scanning across from the right upper quadrant of the liver, scanning across the liver to bring it into multiple views to assess for fatty liver. So talking about liver ultrasound basics. So ultrasound is the first line non-invasive modality to assess for fatty liver. A limitation being it's difficult to differentiate between the stages of fatty liver or assessing the fibrosis level of the liver. When you're doing the liver ultrasound, you want to assess for size and shape, echinogenicity or the brightness of the liver, echo texture, the surface or nodularity, the liver structures like the portal vein and the hepatic veins, and adjacent structures being the kidney. Fatty liver progression to cirrhosis. Non-alcoholic fatty liver disease name has been changed to metabolic dysfunction associated fatty liver disease as to focus on the drivers such as obesity, insulin resistant, and dyslipidemia, all which can be modified, and the fatty liver can be reversed as long as it hasn't progressed to cirrhosis. So if you look here, you'll see in a normal liver, you have a pretty homogeneous texture of the liver. You see that you have periportal fat around the rim of the periportal system. And then as you progress into fatty liver, you see this increase in echinogenicity, specifically to the kidney, and you see this loss of your periportal fat. These are suggestive of fatty liver. And then in your echo texture, as you see this increased heterogeneous texture of the liver and as well as loss of the periportal fat, you know that you're progressing into fatty liver. With severity being here with this increased nodularity, so you see this on the surface where a normal liver has more of a smooth surface. When you see this nodularity, you're in severe fibrosis or cirrhosis. So the normal liver and the kidney have a pretty similar echinogenicity, with the liver being here and the kidney here. And then as you progress into fatty liver, you see here that there's an increased hyperechoic or brightness to the liver as relative to the kidney. With the normal liver, you have this visible periportal fat here. And as you progress into fatty liver, you see that there's loss of that periportal fat around the portal venous system. In the normal liver, you have this homogeneous texture. And then as you progress into fatty liver, you see this more coarse texture or heterogeneous echo texture of the liver, suggestive of fatty liver. On ultrasound, it's hard to call the liver cirrhosis unless you see this nodular surface. So you see here in the normal liver, you'll have this smooth surface on the liver edge. And as you progress into cirrhosis, which is the irreversible stage, you see this nodular surface. And then here again, you see this smooth surface in a patient with ascites. And then here in another patient with ascites, you note this nodular surface, which is a little bit easier to see. And this is when we know on ultrasound that we've progressed into cirrhosis. So in summary, when we're looking at the IVC, subxiphoid, or right upper quadrant on ultrasound, we're going to incidentally bring the liver into view. And it's important to note if we see this increase in echinogenicity, like here we see this increased brightness relative to the kidney, where we see this loss of periportal fat, to note that this patient likely has fatty liver disease and to send them to get a formal right upper quadrant ultrasound. And these are the sources that we used.